You never change things by fighting against the existing reality. To change something, build a new model that makes the old model obsolete. It's so great to see so many friends and people I've been on a journey with for some time, but also so many new and interesting people who share a vision around breaking the healthcare mold. And I don't believe that it will be possible to do so without building something new that makes the old models obsolete. My name's Zach Holdsworth. I'm the co-founder and CEO of Hint Health, and we have the honor of powering thousands of DPC providers across the nation, which represents hundreds of thousands of DPC members and billions of payments in terms of payments to doctors. And I've been invited here by Jay and Keith and Linan to share some of the sort of the evolution and trends within direct primary care. And I'm really excited today to share some of that. But before jumping in, I just wanted to kind of share a little bit of my backstory and kind of also talk about how I sort of got into this. So this is sort of probably preaching to the converted here, and my team's probably gonna roll their eyes when they hear me talking about rockets again. But we're wasting about $1 trillion, depending on who you talk to, about $1 trillion per year in the US healthcare system. And that's about equivalent to NASA's budget since inception. And that's actually including the Apollo mission, the getting to the moon, everything, right? And I just find that just incredible. And for those of you struggling to understand me, that's probably more confusing than my New Zealand accent is in English. But I like to kind of give this analogy because I think it kind of makes it real, at least for people that like rockets. The thing I wanted to kind of talk a little bit about is how I believe that direct primary care is a very powerful solution and something that could be at the sort of core and foundation of a healthcare system that is really kind of redesigned to enable easy access to high quality and affordable care. And this is actually our vision statement at Hint Health. And I actually think that, I enjoyed the gentleman's presentation before, but I actually disagree. I think that direct primary care is a very powerful solution and should play a critical role in tomorrow's healthcare system. So folks are probably wondering here, like, who's the funny guy up there with the New Zealand accent and why is he here trying to transform US healthcare? So I thought I'd just share a bit of my backstory because it's something I get asked about quite a bit. So as I mentioned, I grew up in New Zealand, which is, by the way, as someone had asked me last night, it's not in Europe, it's next to Australia. And by the way, it's also not part of Australia, just to be clear. But anyway, so I'm from New Zealand and I grew up on a farm about 20 minutes drive outside of a town of about 20,000 people. So this is actually not a picture of me growing up in New Zealand. This is a picture of me back home. I went back home when COVID hit just to kind of escape the madness. And this is a picture of me with a goat. I thought it was pretty funny. But this was kind of similar to, this was sort of representative of the type of life I grew up with. This is a picture of me and my wife. And just to be clear, my wife's not the one on the left. So she's the one in the middle. And this is a picture of my daughter riding a sheep, which I thought was also pretty funny. So I thought I'd throw in some farm animal photos because I like farm animals. But part of the reason I share this is because the experience I had growing up in New Zealand, from a healthcare perspective, New Zealand's healthcare system is by no means perfect. But one of the distinct memories I have as a child was how we had a family doctor that knew our name, that would often, sometimes would come to family events, we could go, if we're sick, on a Friday afternoon, he would be there for us. We could call him, telemedicine, right? We could call our doctor. We could, sometimes if we were in the hospital, he would show up in the hospital. It was just this really amazing experience that I sort of grew up to think of as normal. But then I never really, until I found direct primary care at least, I'd never really experienced something like that again. And that's really been a critical part of my journey personally, is wanting to kind of somehow figure out ways to help recreate that experience that I had. So anyway, the story of how I got here, my dad got the first computer in our town. So Who here remembers the Commodore PET? But this will sort of age you probably. But anyway, this was the first computer in our town, and my dad got this computer because he was a bit of an engineering geek. And I like to think this is the machine I learned to code on, but I think actually in reality it was the machine I learned to play games on. But ever since my dad got this computer, I'd always had a dream of going to Silicon Valley. And so I went off and studied engineering, and I had a career as an engineer and sort of did some computer science stuff, and was, sort of eventually was lucky enough to sort of sneak my way into Silicon Valley. I got accepted to Stanford Business School. So I went to Stanford and was in Silicon Valley. And I wasn't exactly sure what I wanted to do, but I knew I wanted to do something entrepreneurial. I wanted to do something that was in technology. And I was also really interested in, at the time, human performance, right? I was really into adventure sports and stuff like that. And so I found a company called WellnessFX, which was basically the first direct-to-consumer clinical diagnostics company with a telemedicine offering. And it was really essentially one of the first basically cash-based offerings whereby you could basically, as a consumer, you could get access to a doctor who would help you order some labs and things, and you could have a consult with a doctor and get information. And it was just a really interesting experience, and it combined my sort of passion for tech as well as this kind of wellness or human performance side of things. But what was really interesting about this journey, well, there was a couple of learnings. The first was that we started to run into these kind of renegade doctors that were stepping outside the system and doing things a little bit differently, and would typically be, from a consumer perspective, be serving someone that was either wanted to understand their health better, they're a healthy person, but they just wanted more information, or chronic disease patients who are struggling to get access to care, and we were the last resort. And it was really interesting just to see those patterns, because I hadn't really experienced the healthcare system a tremendous amount. But in addition to that, it was where I started to understand, and this was just profound for me, was that the majority of healthcare expenditure in the US, 60, 70, depending on who you speak to, up to 80% of total cost of care is run through the insurance fee-for-service infrastructure. And Warren Buffett has been, I love his quote, in that this is really the tapeworm of American economic competitiveness, and I believe that is actually, it's one of the greatest threats to just the idea of America in the first place, because it's essentially bankrupting the US economy. And so this for me was just, this learning just, it was kind of like a light bulb moment for me. And me and my co-founder, who I met at WellnessFX, Graham, decided we wanted to try to do something that would address this. The other thing that we learned is that because of the lack of price transparency, right, the perverse incentives and the high administrative overhead that were attributed to that insurance infrastructure, we were sort of trying to figure out, okay, how in theory can we do something that addresses all of these problems? I don't believe that it's possible to address any single one of these problems in a silo, right? The system's too powerful. There's too many stakeholders that control things. I don't think that you can just only focus on price transparency, right? I don't think you can only look at the administrative overhead or just solely look at ways of changing incentives. I think you need to look at these problems holistically. And so, anyway, we were kind of trying to figure out what to do. And one of the observations we had is that one of the biggest sort of things that the insurance fee-for-service infrastructure had broken is it had broken primary care. And this kind of brings me back to the story I told earlier about how, the sort of experience I had as a child. This was something that you'd almost have the exact opposite of in the US healthcare system under an insurance fee-for-service infrastructure. And one other thing I think was quite interesting is when you look at it, it's not as though there hasn't been any innovation in healthcare. There's been a bunch of innovation, but it hasn't worked, right? There's, it's 40 up close to 50% increase in premiums over the last decade. Right, that far outstrips, inflation as well as just worker earnings. And the way I tend to think about this is the reason for this is because all of that innovation has been built on top of the insurance fee-for-service chassis. It's been built on a broken substrate, and so it's only addressing things in point solutions versus addressing the holistic problem, which is the insurance infrastructure that is all prevalent. So this is where kind of in our journey we started to think, okay, what's something that in theory could address the primary care problem as well as the insurance fee-for-service infrastructure problem? And because there's no functioning healthcare system in the world that doesn't have a functioning primary care system. And so this is where we sort of found this direct primary care space, and we actually went to the first direct primary care coalition conference in St. Louis. And it was this eclectic mix of kind of early adopter, renegade doctors. And I actually remember sitting at the bar, and Clint Flanagan, who's here somewhere, I was sitting just randomly at the bar in this little dinky hotel. And there's probably 80 people at this conference. And the gentleman leaned across things from me and said, "What are you up to?" And I said, "Oh, I'm at this conference, with all these renegade doctors." He was like, "Where are you from?" I said, "I'm from New Zealand." He said, How the hell did you find us? I was like, well, and I told him my story. But that was my first kind of relationship in direct primary care was with Clint and a number of other people I'd met there. But what we found was this really passionate group of doctors that had kind of stepped outside the insurance system, had figured out a model that was actually working, right? That this was kind of profound for us. It was pretty simple. There was no insurance involved, and it worked. And patients loved it. Doctors loved it. We also started to see that employers were seeming to love it as well. And so that's where we decided, okay, hang on, this is a really good example of a working model with nice price transparency, nice natural incentive alignment. We don't need to have a quality score necessarily to get to get nice natural incentive alignment. There's very little to no administrative overhead. And it was a solution that was delighting patients, doctors, everyone pretty much, except obviously the carriers who have been cut out of that picture. And so anyway, that was kind of my journey for how I got into direct primary care all the way from a farm in the middle of nowhere in New Zealand. And really excited to be here because I feel like having a big impact and helping transform one of, I believe, the sort of largest crises facing humanity right now is essentially the thing that will bankrupt the US, the dream of USA. So anyway, that's the story. Now, what I wanted to do is just spend a few minutes talking about the evolution of this movement through the lens of our customers. So we have kind of, about once a year I hijack one of our engineers to help me build a data visualization to help show this kind of journey. And what this I'm about to show you is what's called a force-directed graph, where every single dot on this is a hint customer, okay? And the blue dots are, think of each little blue dot, this is Dr. Rob Lambert's dot back in 2013. Each blue dot's an account. The light blue dots, which you'll start seeing, are multi-location, right? Multiple locations within a clinic. The red dots are actually employers. So you can see through time what's starting to happen is more and more employers are starting to come into this ecosystem as more and more DPC providers are coming along. There's a new pattern that you'll start to see is we started to see networks forming. So this is actually now networks of DPC providers forming organically within our ecosystem. So we actually had to extend our technology to support these patterns. And you can see just this beautiful kind of emergence of innovation and value that's being created here visually. And I like to kind of zoom in here because you can get a much better picture of all the interconnectedness that's happening all organically within this ecosystem. And a number of the providers and DPCs and DPC networks are in the audience with us today. So just zooming all the way back, I just think it's really cool to watch. All the way through time, this is kind of the evolution of DPC through our eyes with the data that we have. And I think it's just really beautiful to see that kind of explosion of innovation and potential happening. And we're seeing it accelerating. So anyway, pretty cool, right? Yay. So anyway, so that's kind of the DPC through the eyes of Hint Health and our community of providers. So one of the things that we've done with this is we've put together a report. We did this in 2017, and it's just kind of a lot of work. This report represents probably hundreds of hours of painstaking work, thousands of doctors, hundreds of thousands of DPC members, billions of data points. Well, actually, no, sorry, probably millions of data points to be fair. And you can feel free to download it. It's free. But it also includes a consumer insights research study we did of over 1,000 US consumers, which we funded, as well as other databases such as the Kaiser Family Foundation, and I think there's a couple of other reports that we've kind of pulled information from, and ultimately kind of aggregated this data to form what we call the Direct Primary Care Trends Report, and I think it's pretty cool. I wanted to just share a few of the data points from this report and just kind of talk through some of the trends that we're seeing that I think are pretty interesting. So the first actually is kind of just a Google search thing that's in this report, but I found it interesting just to see people are looking for DPC, right? And in 2014, I think that might have been me looking for it because that seems like a bit of a blip. But it's just interesting to see that the number of people looking for DPC is increasing, right? Interesting. The other thing that's interesting here is you actually, from Jay Keese, will be hearing a much more detailed version of this, but states are continuing to adopt DPC favorable law. And Jay will go deep on this, but you can see that sort of the number of states that are doing this is going up fairly, in a really healthy way. And of course, what's happening is, so congrats to all the people that have been working on that. I know it's often a pretty painstaking process to get this through, and I know that it's typically local and people are really pushing hard on it. What this does is, of course, leads to additional DPC doctors that are able to enter into the space with less sort of regulatory headwinds. And what we're seeing is just over the last 4 years, about a 3x increase in DPC doctors as a percentage of the population, right? So that's pretty interesting as well. Obviously a good trend. And then after that, what we're seeing is active DPC membership growth again as a percentage of the census, and that's increased about 4x over the last 4 or 5 years, or 3 or 4 years, which again that's if you think about it, it's pretty fast, right? Pretty fast growth rate. And what I actually like to do with this is I think it's quite interesting, just if you kind of skip backwards and forwards through this, you can see a little bit of correlation between regulatory and sort of DPC doctors. There's some correlation there. And then there's sort of correlation also between doctors and clinicians, as well as the DPC members when you look at it kind of on a map. So pretty cool. So that's the sort of growth rates. One of the things I like to articulate here is it's not necessarily easy to do it, right? To do DPC. So what this can show is it can take a few years to fill a panel. Right, and so you'll notice that the growth rate after, we take this data from 6 months in, because often it takes a little bit of time for us to have good data on a customer. But what you'll notice is there's a fairly quick growth rate, and then it plateaus out after about 3 years or so, which again is not too bad, but it can take some blood, sweat, and tears to get there. But at the end of the day, it's the promised land once you're there. If you're a doctor, and if you're wondering about that, just go to any one of the doctors in the room that's doing DPC, and you'll kind of get a good picture of that. So then the question is why is it getting adopted, right? Like what are some of the reasons for this? And I'm not going to give you all the reasons today, but there are a few data points I thought that were really interesting that came out of this report. The first I found fascinating, right? DPC is not getting more expensive. Now, I'm pretty sure we can't say that about pretty much everything else in the healthcare system, right? Like the total cost of care is compounding, 10+% per year. I don't even know the exact number, but it's a lot more than zero or slight negative. And the way I tend to think about this is direct primary care providers have figured out their value, and it's they've figured out a value proposition that makes sense to them, makes sense to the consumer if it's a consumer paying out of pocket, or makes sense to the employer. And they're not sort of trying to drive the costs up every year thereafter they're trying to essentially fit the value to the service they're delivering in such a way that creates value, right? It's a price transparent incentive line model with very little to no administrative overhead. So I thought this was quite interesting just to see this trend, because I was actually expecting the numbers to be increasing slightly. So that's one data point. The other one is really, this to me is probably the most profound data point of this entire report, is direct primary care is pandemic resistant. So, 60+% drop in fee-for-service outpatient visits within a few weeks of COVID kind of hitting. And we all heard stories about doctors going out of business, not being able to treat patients because they couldn't keep the doors open. Like, when there's a pandemic, you kind of want some doctors to look after you, right? You don't want them all going out of business. So for me, this was just, the system sort of failing when there's a bit of a step change input. This was a really good example. On the flip side of that, it was almost as though there wasn't a pandemic when you look at the growth rate of members within a DPC clinic. So what we found is that our clients, they continued to grow about at the same rate that they were growing before, right? We didn't see, I actually panicked a little bit because I thought, oh my God, all our customers are gonna go out of business. I don't know why I thought that, but the reality is that it was as though there wasn't a pandemic when you looked at the data. And I thought that was just really fascinating, because what you want when there's an emergency is you want the people that are responsible for helping deal with the emergency to be able to survive and have a functioning business that makes sense. And so I thought this was a really interesting data point as well. The other thing I think is interesting here is employers are increasingly adopting DPC, right? Employers are starting to realize with the writing on the wall, hang on, maybe there's a better way here. Maybe we should invest in our primary care, and this model seems to be working. And so what you'll see here is the kind of light blue line is growth rate in sort of retail, so people signing up for a membership out of pocket, and the dark blue line is employer adoption. And I think this is just really interesting to see that employers starting to tick up, and it's actually driving a lot of the growth within our ecosystem. So that's the high level in terms of the report. There's a bunch more data in there. Please feel free to download it. What I wanted to kind of just spend a minute on here is that I've talked a bunch about direct primary care and why I think it's awesome and everything. But the reality is, the way I tend to think about the problem we're facing right now in the US healthcare system is these concepts are not just relevant to direct primary care, right? There's no reason that these concepts can't be applied to other areas of healthcare. And of course, this conference, I'm preaching to the converted here probably, but this is a great example of this. And the way I tend to think about it is, are there ways that we can bring price transparency, nice natural incentive alignment, and low administrative overhead? Are there ways we can do that outside the fee-for-service infrastructure that's not layering in additional complexity on top of a broken system? Right, and I tend to think of the shift to value-based care as a large part of what's happened here. Is a lot of that innovation has been built on top of the status quo infrastructure, and I think that's actually a problem, because it can cost up to $50,000 per doctor per year to report quality measures. Right, something doesn't seem right about that. So the way I tend to think about it, and the vision that we have at Hint, is there a way that we can create this direct care ecosystem of transparently priced direct pay relationships that are grounded in a foundation of affordable primary care or direct primary care. And what we do is, common predictable care is moved out from under the insurance umbrella, just leaving unpredictable high impact incidences within the insurance arena. And the way I tend to think about it is this is sort of a collaboration between the DPC providers and the rest of the ecosystem of direct care providers that are all sharing these common principles of price transparency, natural incentive alignment, and low administrative overhead, and doing so in such a way that together we can redesign the healthcare system to enable easy access to high quality, affordable care, and importantly, not doing so just sitting on top of the old broken system, right, in a way that's net new, right? We're building a new model that can make the old model obsolete. So that's all I've got for you today. Thanks so much. Please download the report. Cheers.